Hello, my name is Shania. I'm a part of Group 3, and the topic we're presenting is the rising cost of healthcare. Throughout this presentation, we'll be discussing why healthcare costs keep rising, what are some of the key challenges, what organizations have been impacted by these rising costs, what has been the response in our industry so far, and what we can expect in the future if these costs continue to rise. So now I'll move into the first section. In 2019, the federal government spent nearly $1.2 trillion on healthcare costs. Medicare claimed roughly $644 billion, Medicaid and the Children's Health Insurance Program about $427 billion, and the Veterans Medical Care about $80 billion. Throughout my research, I found that the main reason for the rising healthcare costs is government policy. Since the inception of Medicare and Medicaid, private providers have been able to increase prices, which has contributed to the continuous rise of healthcare costs. Secondly, another reason for the rising cost of healthcare is the increase of preventable chronic illnesses. Heart disease, cancer, and stroke can all be prevented or would cost less to treat if caught in time. However, this rarely happens and thus results in higher spending to manage these illnesses. Third, thanks to a lack of transparency and underlying efficiency, it's difficult to know the actual cost of healthcare. Most people know the cost of healthcare is going up, but with few details and complicated medical bills, it's not easy to know what exactly we're paying for and why we're paying such high costs. Moving on to the second slide. Who does the rise in healthcare affect the most? Well, us. It affects us, the consumers, the most. Why do I say this? While majority of the people in the U.S. receive health insurance from their jobs, they still find it difficult to afford routine costs of health insurance like premiums and deductibles. So imagine just how difficult it is for the unemployed and uninsured population. Healthcare costs in this country is one of the leading issues Americans struggle with. Secondly, half of U.S. adults admit to putting off or skipping some sort of healthcare treatment in the past year because of the cost, and about 1 in 8 say their medical condition got worse as a result. 3 in 10 adults also admit to not taking their medications as prescribed at some point in their life because of the cost. The rising cost of healthcare is detrimental to consumers as well as providers. But now I'll hand the presentation over to my teammate to discuss its challenges.
My name is Tajay, and I'm focusing on the rising cost of healthcare. Why does healthcare costs keep rising, and why is it a challenge? Healthcare costs have drastically risen between 1996 to 2015 by $1 trillion. Healthcare costs is continuing to rise significantly also. The population's demand for more specialty drugs and more access may drive the costs more due to several key factors. Many other key factors include the increase in population growth, the increase in the aging population, the high disease prevalence and incidence rate, the high medical service utilization, and definitely the lack of price transparency. I've actually researched this, and in one region, there was a time where a hospital was charging $50,000 for a knee replacement, whereas other contracted nearby providers or other providers in general, the average was between $7,300 to $10,550 for nearby providers. As you can see, lack of price transparency could definitely significantly cause the rise of healthcare costs. And also, high medical service utilization. Many individuals, which is known as the moral hazard, when they know they are being covered, they tend to utilize medical service more often. So that's another significant contributing factor. And of course, with the aging population, there's more demand for medical services. With the high disease prevalence and incidence rate, such as diabetes. Diabetes alone have went from 44.4 billion and cost expenditures to 64.4 billion within the past 2 years. So moving forward, why is rising costs a challenge? Rising costs affects payers, private and government, which is Medicaid, Medicare, or private insurance companies. It affects employers, healthcare providers, and regular individuals. Rising healthcare costs is a challenge because we're unable to focus on innovative aspects. Thus, it's making it more challenging to formulate benefit packages and other healthcare innovative aspects such as new and improved EHR information systems. Not to mention, a huge issue of rising healthcare costs is that it limits coverage for individuals, especially those who are facing financial hardships. A need for better price transparency and better medical utilization efforts are needed to alleviate the rising costs in healthcare. Last but not least, why is rising healthcare costs a challenge? Cost is the main topic of discussion when healthcare is mentioned on the private and political climate. Rising healthcare costs disrupts necessary routine care. Like as you continue to go to the doctor, if you have a high deductible, you have to face the same cost, if not more, over time. And for individuals with chronic conditions, it could be a very hard problem for them. Because if they're facing financial hardships or things of that aspect, and they have to deal with a chronic condition, they have no choice but to deal with the routine care. It's gotten to the point where some individuals with chronic healthcare conditions are skipping routine care due to costs. And it's already some difficulties paying medical bills, especially unexpected medical bills. Hospital bills being a true number one factor in rising healthcare costs. With that being said, the rate at which individuals are becoming uninsured is increasing at an alarming rate. And the need for action to significantly reduce healthcare costs is needed now more than ever. And I am glad to share this with you.
Many organizations are being impacted by rising healthcare costs. These include hospitals, insurance companies, pharmaceutical companies, and even consumers. While hospitals should benefit from the reduction in percentage of insured individuals, they may also see a continuation of high deductibles in those through employer and marketplace coverage. The rise in healthcare costs will also cause pharmaceutical companies to increase their costs. Patients suffering from things such as chronic conditions pay thousands of dollars, including prescription drugs, before the cost of any treatment is even covered. High cost sharing increases the chances that patients will not fill their prescriptions and not adhere to recommended therapies, which can adversely affect the patient's health, as well as decrease sales for pharmaceutical companies because of this. Consumers are finding it increasingly difficult to bear the burden of mounting costs, and many are searching for ways to manage this expenditure. Because of this, U.S. health consumers are willing to skip care or use over-the-counter products to avoid the cost of doctors' visits and hospital visits. Many will opt out to fill prescriptions, take less than the prescribed amount, or having trouble getting better behavioral health care. Patients will have to incur a bigger cost because of this should their health worsen. A growing number of individuals are buying health plans that have lower premiums, so they're less expensive on a monthly basis, but have higher deductibles, without understanding that these plans will not pay for a doctor's visit or for prescription drugs before the consumer meet their annual deductible. But due to an increase in healthcare costs, insurance companies are also having to increase their premiums. This often causes the consumers to buy the cheaper ones, which tend to have the least amount of coverage. So overall, because of the rising healthcare costs, many companies are also ranking up their prices, kind of leaving the consumers to pay more for the norm.
Healthcare is constantly evolving, and with that, the price of quality care is consistently rising. The major organizations that carry the weight of these changes are hospitals, physicians' offices, insurances, and employers. One of the key elements of healthcare reform is cost reduction at the provider level. This focus is paramount at accountable care organizations. The goal is to create capitated contracts that encourage providers to shift attention from optimizing reimbursement to increasing quality while containing costs. A few methods hospitals are using to estimate costs at the service level are cost to charge ratio, relative value unit, and activity-based costing. A new addition is time-driven activity-based costing, a relatively new approach that focuses on costing multiple services provided to individual patients. CCR is a ratio used to estimate the overhead costs of individual services, defined as the ratio of indirect overhead costs to charges, or alternatively to service revenues. RVU, the relative value unit method, ties the use of overhead resources to the complexity and time required for each service. This method uses the intensity of the service provided as measured by relative value units as the basis for allocating overhead costs. Ultimately, RVU is necessary to reflect the cost of the overhead resources used to provide the service. Next, activity-based costing uses an upstream approach to cost allocation. With this approach, the idea is that all costs within an organization stem from activities. In ABCs, because activities rather than departments are the focus of the process, costs can be more easily assigned to individual parties and factors such as patients, physicians, particular diagnoses, a reimbursement contract, a managed care population, and more. The time-driven activity-based costing offers the promise of expanding the concept of cost measurement beyond individual services costing, which can lead to better low-cost treatment plans. The idea behind the TDABC method is that individual service costs are not the correct way to view the cost of providing services. Rather, the costing system should account for the total cost of all resources used to treat a single diagnosis as a patient moves through the entire health system. The basis of the TDABC method is that the value of healthcare services must be measured in terms of patient outcomes achieved per total dollar expended. Value is increased when outcomes are improved at similar costs or when costs are reduced while maintaining outcome quality. Most physicians' offices consist of a charge-based environment in which managers of healthcare providers must set prices on the services that their organizations offer. They must determine whether or not to offer volume discounts to value payer groups, such as managed care plans or business coalitions, and how large these discounts should be. Service decisions includes insurers of governmental and managed care plans dictating the reimbursement amount. In these instances, health services managers are not setting prices but must decide whether or not the payment is sufficient to assume the risk associated with providing services to the covered populations. As providers respond to market competition, managers must assess their organization's ability to influence the prices paid for the services offered. Organizations with a large number of providers in a service area with a large number of commercial fee-for-service purchasers and unnoticeable distinguishes between the services offered by different providers are able to set prices based on local supply and demand conditions. Price setters are healthcare providers who, within certain limits and boundaries, providers can decide what prices to set on the services offered. Furthermore, if a provider's services can be differentiated from others on the basis of quality, convenience, or other characteristics, the provider has the ability to set prices on the differentiated services. Third-party payers previously accepted price shifting because of their concern for the greater good and the fact that the additional burden of cost was not too excessive. However, the overall cost of healthcare has risen so much that major payers of services are less willing to support the costs associated with providing services to others. This is now resulting in payers demanding the prices that cover only true costs without cross-subsidies. Third-party payment programs can address low-income consumers affordability concerns on a large scale. Healthcare providers pay low-income consumer shares of enrollment costs. Unfortunately, with TPP programs, there is a fear that they could skew risk pools by triggering adverse selection or cause a high enrollment of consumers with serious health problems. For example, carriers have raised concerns about healthcare providers increasing their payments for kidney dialysis and other high-cost conditions by encouraging patients who qualify for Medicaid or Medicare to nonprofit organizations, causing patients to enroll into marketplace plans that pay higher reimbursement rates. And finally, employers. According to the 2020 Large Employers Healthcare Strategy and Plan Design Survey by the nonprofit National Business Group on Health, large companies are predicted that their total cost of healthcare for premiums and out-of-pocket costs for employees and dependents will rise to $15,375 per employee in 2020, almost a $1,000 increase from the previous cost of $14,642. A CDHP is a high deductible health plan linked to a health savings account or a health reimbursement arrangement. The number of employees offering only CDHPs for healthcare will shrink to 25% in 2020, down from 30% this year and 39% in 2018. The NBGH survey showed that instead employers are offering additional coverage choices like a preferred provider organization plan. To compensate with all of the changes, employers are investing in alternative low-cost solutions such as telehealth. More than half of large employers are planning to expand the range of telehealth benefits to include services such as mental health counseling and app-based physical therapy consults to manage costs and improve employee health and well-being. However, high-cost specialty drugs are employers' top concern in managing pharmacy benefits. Employers are very concerned about how to finance the high cost of new million-dollar drug therapies, considering some of these therapies will cost more than what an employee will earn in a lifetime.
Good day, my name is Annia de Gorville. Today, I will be covering the topic on other measures recommended within healthcare when rising costs. Two major factors regarding the power of healthcare: providers to set prices or providers have no power whatsoever and must accept the reimbursement rate by the marketplace. Additionally, providers can set, within reasons, the desire and payers must pay those prices. In addition, measures recommended to set prices in healthcare are price setting strategies, fee for service, price under capitation, and strategic planning. Price setting strategies are implemented when providers are price setters. Full cost pricing includes the following: the direct variable of providing services, the direct costs, the appropriate share of the overhead expenses of organizations to ensure full capability, and profit component. Marginal cost pricing. According to the text in economics, the marginal cost of an item is the cost of providing one additional unit of output, whether that output is a service or a product. Target cost is a management strategy that helps providers deal with situations in which they are price takers, as we covered in our text. This strategy helps reduce costs, if necessary, to a point where a profit is earned on the market-determined prices. Next, one of the most common in healthcare, the fee-for-service system, is defined as a payment mechanism in which healthcare providers. Organizational goals are subjective goals that organizations strive to attain. Organizational objectives are quantitative goals that provide managers with measurable target. Thank you.
So, what does the future hold for the rising costs of healthcare? The future of the rising costs of healthcare will largely depend on the new administration and the direction that they take to lower healthcare costs. America does not have a unique population when compared to other countries with lower healthcare expenditures. So therefore, our increasing healthcare costs are largely a result of a dysfunctional system. Some of the goals of the Biden administration in regards to healthcare include an expansion of the Affordable Care Act. Biden plans to insure an estimated 97% of Americans by expanding coverage, particularly to low-income Americans. New public health insurance option, so something like Medicare for All, would allow Americans the option to have public health insurance and would also take the burden of providing health insurance off of employers. Stricter guidelines for prescription drug corporations, so that's working to keep medication prices fair and reasonable, working to reduce disparities in healthcare by addressing discrimination and lower quality of care for minorities, and then also a push for preventative care.